Hi, I'm Dr. Prahsant Soni. Today we're going to be doing an injection of Bellafill to the hands. Bellafill comes from the company Soniva, and it's a long-term filler that we can use to help replenish the volume in the hands, and it can last anywhere up to 3 to 5 years. So I'm going to take you through how we do that here, and this is the company, and the product is packaged like this. I don't know if you can see that, but and it comes in a pre-filled syringes. This is a syringe that we're going to use today, and we're going to be utilizing a cannula technique, which is a nice non-traumatic way to introduce the filler into the hands. We use it in the face and other areas as well, but it really is the state of the art in terms of using fillers these days. So we're going to start right now. So as you will see, right now I have kind of drawn with my marking pencil the areas between the tendons and bones that are on Helen's hands here. Press against my finger like you did before. Yeah. So you can see right here, I'm going to turn your hand a little bit, that there's these indentations, which are pretty obvious, you know, when you're moving and closing your hands. So I'm just drawing a little area here to kind of highlight those areas for myself. And now, I've already cleansed the hands and sterilized it. I'm going to put a little numbing injection just in a couple of spots. Now, as you can all imagine, there's certain areas where there's a lot of blood vessels and veins in the hand. So utilizing the cannula technique is a great way to limit your bruising. It's a little pinch. Good. Pinch right here. A little bit right there. Good. I'm going to do a little bit right in this area. Now we're going to start. We'll just march along the different areas. Press against my hand again like you did before. Great. So this is the most obvious area. So I'm going to put your hands flat for me. Make a little. And that part is pretty much going to be numb at this point. So we make this little finder needle that helps establish our trajectory. Good. Now the needle's been introduced here, and now I just literally kind of tent up the skin and introduce the cannula, and because there's no sharp tip to the cannula, it doesn't hurt. It just kind of finds a nice natural plane in which it goes, and then I just kind of inject the Bellafill as I withdraw, just like that. And there's certain ways some people like to thread it, and I like to do a bit of both, where I just deposit a little amount in the area that I want to be. And there, I've done that now. And now I'm going to move over to another spot, and then we will massage it in so it's nice and smooth. Good. And I'm going to take your hand up again. Push up against my hand like you did before. Great. I'll make a little poke right there. Just like that again. Nice and easy. Lay your hand down for me. Tent up the skin a little bit, and just do a little injection right here, threading it. Very good. Okay, and we're going to march over to another spot. Flex your hand again for me like that. Okay, we're going to go right here now. And generally speaking, depending on how bad the areas are, one syringe tends to be the average I use for each hand. And you can certainly supplement it. Mind you that the longevity of this is so long that you can easily do some, today, and a year from now you can do some more if you feel like you want some more, and you really haven't lost much of the benefit of the original injection that was done. And that's really one of the main benefits of this. Right here now. Flex your hand like you did last time. Right. A little bit here, a little pinch. Maybe. Once again, the cane goes very gently, it's very easy. A little bit more on that side. I can see you need a little bit more. Alcohol swab. And I'm going to take a little bacitracin just to massage it. And the last step of this whole process, as easy as can be, let's put a little lubricant on the skin. And then we just massage it in. And that's it. A little bit of massage into these areas. What to expect after this treatment? You might get a little swelling in the hands, so one of the techniques I do is I like to wrap the hands with a little bit of gauze and a pressure dressing for just a couple hours. You can certainly drive yourself back and forth. It's not like not wrapping your fist up like you're going to go in a prize fight or box or anything. It's just a little dressing that you can take off later in the day. And ice. And that's really it. You can do anything you want afterwards. There's no limitations on your activities. And now that I've done this, it's perfectly smooth, and it's really blended, and her hand is very soft. And you can just straighten out your hands. And that's really how it is. That's all there is. Thanks for joining us.